Hello and welcome to the classes of Pediatrics, 𝗧𝗲𝗹𝗵. Myself Dr. 𝗵𝗺 and we are discussing the subject of pedia. So the topic of discussion for today's class is going to be abdominal pain. This is a very small video, but then I have seen many professors asking these questions to the UGs that whenever you utter a word that my patient is suffering from abdominal pain, so they'll bombard you from 5-6 questions, and these 5-6 questions, of course, I am going to discuss with you in this lecture, and this is equally important when it becomes a case-based question, a case-based scenario. So let's dive into the topic of pediatric abdominal pain. So in most of the cases, the goal of evaluation of pediatric abdominal pain is to see that if the child is having some self-limited cause, like constipation is also responsible for stomachache or abdominal pain, or gastroenteritis. Like both of these cases are actually self-resolving in case of pediatric population, whereas some are life-threatening conditions like appendicitis, like obstruction, like perforation. So these are actually the life-threatening conditions, okay. But there are some self-limited causes like constipation as well as your gastroenteritis. So how will you differentiate on clinically? So see, if it's appendicitis, of course the pain is going to be right lower quadrant pain. The child is going to have rigidity, and of course there will be migration of pain which is going to be there. Okay. Then intussusception, please remember intussusception is something where one bowel loop is going to enter into the another. That is called as intussusception, and intussusception is very important for the 6 months children. Why 6 month history? Because it is commonly seen when there is weaning which is going to happen in children, and in intussusception it is commonly seen that the legs are drawn up. Okay, legs are drawn up in cases of intussusception. In volvulus or in malrotation, the neonate is going to present with the bilious vomiting. This is important. Then if you have something which is called as inguinal hernia, you are definitely going to have a discrete groin mass. In intestinal obstruction, there will be history of some surgery or some adhesions like that. And in necrotizing enterocolitis, the premature neonate is an important risk factor. So let's just quickly revise. In appendicitis, there will be right lower quadrant pain, there will be rigidity and migration of pain. Intussusception occurs in the weaning time, 6 months old, and legs drawn up. Malrotation, or you say volvulus, is going to present with the bilious vomiting. Inguinal hernia is going to have a mass. Intestinal obstruction is going to have history of adhesion, and premature neonate is going to have necrotizing enterocolitis. So this was a small video, but yet very, very important video, and we will see you in the next class. Thank you so much for watching.